Safe registered nurse staffing levels. Say yes. Presented by Sarah Frog and Duke University. Every day, 2.6 million registered nurses in the United States attempt to provide quality care to the millions of people utilizing the healthcare system, each of whom hopes to receive excellent health care. Yet these 2.6 million registered nurses continue to struggle to provide the best care due to inadequate staffing levels. We have all experienced the delivery of healthcare in some way, whether as a patient, friend or family member, or as a healthcare provider. We have all seen examples of excellent healthcare, and unfortunately, we have all seen examples of poor healthcare. Recently, the Centers for Medicare and Medicaid began tracking a set of indicators known as never events, and have decreased or denied payment to hospitals for patients who experience these never events. Never events such as pressure sores, commonly referred to as bed sores, patient falls resulting in injury, urinary tract infections from catheters, and infections from vascular catheters are all directly associated with nursing care. The most basic level of care must be provided to prevent these events. Yet many hospitals struggle to provide this care due to a lack of adequate staffing. Some have proposed the implementation of mandatory minimum registered nurse to patient ratios to improve staffing levels, overall patient care, and decrease cost. However, mandatory minimum registered nurse to patient ratios are not the answer to this problem. California, the only state in the United States to implement mandatory minimum ratios, has demonstrated increased cost and no improvement in patient outcomes. Safe registered nurse staffing levels determined by each individual unit within a hospital are the answer. Safe registered nurse staffing levels are tailored for the specific population of each unit, whether intensive care units, postpartum units, Alzheimer's units, emergency rooms, and the list goes on. These staffing levels are determined by utilizing the input from registered nurses that practice in each unit. Safe registered nurse staffing levels have been shown to decrease mortality, reduce the rates of never events, decrease overall costs to the patient and hospitals, and increase registered nurse job satisfaction. So if you want excellent health care, please say yes to safe registered nurse staffing levels. Safe staffing saves lives. Safe staffing is supported by ANA, ANOE, and AHA.